Hi everyone, Dr. Nemechek here. And I want to go over and explain how most of the negative behaviors we have in kids with autism and the kids with developmental delay, how most all of these problems are related to one neurological issue. And that issue is what's called cerebral hypoperfusion, which you can think of as having low blood pressure in the brain. Okay? Not low blood pressure in the arm necessarily or in the chest, low blood pressure in the brain. And what happens here is it makes it difficult for oxygen to normally get into the brain. So basically you have red blood cells that carry your oxygen, you breathe, you fill them up, you got to push it at this right pressure for that oxygen to diffuse into the neurons, okay? And if that doesn't work right, you got problems. Now, this is typically due to dysfunction of the autonomic nervous system. And the autonomic nervous system is what regulates your whole physiology, all your organs, your blood pressure, your heart rate, your immune system, your metabolism, your emotions, your hormones, regulates all that stuff. And if the autonomic nervous system gets injured, you basically have two things. One is you can have a slow intestinal tract, and that can give you a bunch of symptoms, or you end up with low blood pressure in the brain. Now, in non-autistic individuals and just your adults, like after a concussion, the kind of injuries we get, you can have physical injuries like concussions, you can have emotional trauma, that's called a Takotsubo event, you can have surges of inflammatory stress from surgeries and fractures and COVID and different things. And then in autism, where we suspect that we're having bacterial overgrowth in the small intestine and that those bacteria are releasing a compound called propionic acid. And there's some data in the animal models that propionic acid can cause a chemical injury. Okay, we don't exactly have that proof of that in people, but there's definitely something going on in these children because you cannot account for the degree of their autonomic dysfunction by just tallying up like physical, emotional, or inflammatory. I'm feeling pretty strongly they have this chemical injury, if you want to think of it that way. Now, so with low brain blood pressure, you don't get the proper flow of oxygen into the neurons, and there's some degree this is a glucose issue as well, and the brain doesn't work well. Okay, so you end up being tired, poor focus, poor attention. I mean, this is attention deficit disorder. It's low blood pressure into the head. Okay, you have poor recall. Now, so this can affect things that children know. So receptive skills like or expressive language. There are many children who could speak, 20 words before they slid into autism, and now they can't say anything. These kids at times you'll have these weird circumstances where suddenly these kids can say those same 20 words again. And that might be years later. And so it's really just the inability to recall what you've learned, okay? And this, we use this phrase like somebody was given an award and they asked them to get up and make a few comments, and they'll say, oh, you should have seen Bob was speechless. He was so nervous. What happens is the blood pressure drops, and even adults sometimes can't talk, okay? Now, this isn't all kids, all right? Certainly we have kids with autism that developmentally haven't developed that skill yet to speak, and so, but this is part of the picture that you're seeing. Comprehension is pretty bad. Again, this is like attention deficit disorder, but actually much worse than what you'll see like in a teenager. You can have low pressure in the scalp and neck muscles, and so you get headaches, neck tightness. It can even alter your balance a little bit in that way. So you have a whole bunch of symptoms, but really in the kids, a lot of the symptoms you get are this poor focus, comprehension, stuff like that. Now, the brain doesn't like this. the brain thinks it might be drowning or something because it's not getting enough oxygen. So the brain will react to do things to try to improve the blood pressure and give itself more oxygen. So the brain will actually make the child hyperactive because the blood pools down to your legs when it's not working right. And if you can constrict those muscles, it'll generate pressure upwards into the brain and give you more oxygen. So that's your hyperactivity. That's toe walking. Okay? These kids will, if this is your head here, these kids often will be slouching around, laying flat on the sofa, even be kind of these upside down positions. They're getting rid of gravity and trying to get more blood pressure, oxygen into their head. They'll crave salt and sugar. Those foods will boost blood pressure to your head. That can make you very thirsty. That'll boost blood pressure to your head. Now, if there still isn't enough pressure and oxygen, the body releases a very potent hormone called norepinephrine. All right? For any of you who took like Psychology 101, it's known as your fight or flight hormone. Fight or flight. And so this hormone is really supposed to be, it was designed by nature to help protect you like when you're in the jungle and there's tigers around. Okay? You have this heightened sense and you're ready for a fight or you're ready to run. And so the fight part, that's what's giving you aggression. These intense aggressive episodes, you can have these self-injurious behaviors, biting or hitting themselves in the head, or just out and out violence against other people. Okay, these surges, the parents will often say pupils are dilated, and they'll say, their child is like an animal, and that's because they're releasing this chemical. And then, so the flight part of fight or flight is panic, anxiety, fear, and elopement. So there's some kids that just, boom, take off running. Okay? They're feeling this chemical in their brain. And it's just forcing them to do these things. Okay? That's what you're seeing. Now, what makes this worse? So when you get these negative behaviors, and typically negative behaviors are the hyperactivity can get worse, or you start getting all this aggression. Pain can make it worse. So pain typically like things like teeth, headaches, ear infection, all right? Now, there's certainly other sources of pain, but you're going to figure that out. If they broke their foot or something, you'll see that quite obviously. These are the ones that can kind of hide from you. Infections, sinus, middle ear, urinary tract infection can do it. Lack of food or liquids, because remember I said that salt, sugar, and liquids will boost pressure to your head. So if you're sitting still and you aren't eating, your pressure's dropping, and you'll start doing worse. So this is, you're in the car, they're sitting still, the blood pressure's dropping, you're giving your kids some crackers or orange slices or something, and you think they have low blood sugar, but actually it's low brain pressure is what you have. And then constipation, the contracture of the bowel with constipation can drop your pulse rate, and subsequently it'll drop your blood pressure and make that worse. Okay? Situations can do this. These are typically, lots of times you'll know this. So, baby crying is a common one, or the vacuum cleaner, the microwave. These are things I've heard quite frequently, that if the child hears that, it'll drop their pressure and they get aggressive. Maybe people they aren't familiar with, so they might be kind of frightened. Performance stress. So this is, like the therapist is trying to work with you, or somebody, you're trying to put these pressure on the child and they do worse. And that'll drop your blood pressure and give you some aggression. And then just kind of being irritated about, like, you don't want to do what your parents want you to do. And this is your transition problems. Okay? Put down the iPad, you gotta take a bath. Okay? Drop in pressure, release norepinephrine to try to prevent you from passing out, and you get that negative aggressive response from that. In the environment, you can have things. So when it's real hot, if you get really hot, that can drop your pressure. just unfamiliar environment. So sometimes the kids, when they first come into my office, they're starting to act out because they're a little afraid of what's might happen in here, crowds, excessive noise. And then sometimes, I see this more with adults, but you'll see this in kids sometimes, like closed-in spaces, so like the grocery stores, or even like Home Depot, the big department hardware stores. The shelving goes way up, and it creates this kind of panicky environment for people. It'll trigger that in that environment. So, and a lot of these you can figure out, though, the situational stuff that's going on. The tricky ones are the infections. You got to kind of work through that list if you're having trouble. Now, how do you think about this? Okay, you say, my child's aggressive. All right. We got a lot, he's self-injurious. And so first is it associated with anything in particular? So if it's like with this one therapist, they go crazy, so you can piece that together. Parents are usually pretty good at that. Now, this is where you break it down, the harder part. So you have a kid on the protocol and they're improving. So you're seeing a lot of things improving, okay? But as like speech is improving and socialization and comprehension stuff is improving, but you see now aggression worsening. So neurological improvement with worsening aggression. What is that? Well, if it's been going on for just a couple weeks, I'm thinking things like infections, dental stuff, like teeth coming in, molars coming in, or constipation. Okay. Once things start going on a bit longer, the infections aren't really going to be part of it, because if they have a middle ear infection and they've been aggressive for 4 or 5 days, you're going to have, by 2 weeks, 3 or 4 weeks, it's either gone away on its own or you've already taken them to a doctor, okay, because of just that short-term thing. If you have this kind of slower, progressive kind of aggression building, I'm thinking, again, dental, because like say you have an impacted molar, it's going to slowly worsen as it's coming in. The constipation can still be an issue, or maybe some other medical problem. Maybe they develop Crohn's or something. I mean, that's not very common at all, but you have to now, if this keeps going on, you got to start looking at other scenarios here. So that's neurological improvements, but the aggression is worsening. 3 is no neurological improvement on the protocol, and the aggression is worsening. So this could be either the protocol never worked at the beginning, where you're using inulin, or it was working and now you've plateaued and you've quit progressing. And so what I'm thinking here is we just lost the ability to control the bacterial overgrowth in the intestinal tract. So if you're on inulin, you might go to rifaximin, continuous rifaximin. If you're already on continuous rifaximin, you might try adding inulin or PHGG to the rifaximin. If you're on say rifaximin and inulin or just rifaximin, I always think about adding glutamine for possible leaky gut from COVID. That's a different issue, and there's some other I have some other videos on COVID and glutamine you can watch. And so that's just kind of a simple breakdown of what do you do next. As you can see here, I don't add a vagal stimulator for aggression getting worse. Okay? If it's short term, I'm looking for a cause. Like we have neurological improvements, I'm just looking for the cause, fix the cause. If it's longer term and there's no overall neurological improvement, that's basically you got leaky gut. And you've got to balance that, and you've got to fix that. That's what that means. Now, you've got the child on the protocol, and let's say you're thinking, oh, I just got to change the protocol. I'm going to go from inulin to rifaximin. Well, what are you going to do till then? Okay, there are things you can do to help. Now, if they're constipated, or if they're constipation just doesn't mean passing any, some small amount of poop once a day. Okay? That doesn't mean they're not constipated. You want some good stool production. And because remember that cramping down can drop the blood pressure and trigger norepinephrine to be released. So you might give them a trial of Miralax. Give it once a day or twice a day for a few days and get that stool passing and see, boom, did the aggression drop? You can figure that out pretty quickly, okay? Adding salt to their diet. Some parents will put a little salt in water and have them drink that. And they may have that sitting around the house to sip on. That's fine to do. Physical activity, bouncy balls, mini trampolines, take them for a bike ride. Those things can all help. Just as for the time being, while you're waiting for the nervous system to recover by getting the protocol to work better. You can boost blood pressure. Okay, I prefer a drug called Midodrine. Will actually help boost pressure in the head, but that's also what Adderall and Ritalin do. Okay, they boost blood pressure to your head. Now, the problem with Adderall and Ritalin, in my opinion, is the kids with autism just have far too many side effects from it. They don't tolerate it well, whereas they tolerate the Midodrine pretty good. Now, again, drop in blood pressure, you release a chemical called norepinephrine. Okay? There are medicines, clonidine, doxazosin, and guanfacine. They block norepinephrine. Okay? And so you can use medicines to block that while you're working on the protocol to get the nervous system to recover. Now, this sounds funny, but these medicines also lower blood pressure, so they can actually compound and make things worse. So sometimes the kid's been on it or is put on too high of a dose and they're getting aggressive. It's because the pressure's dropping from the drug. So it's a little confusing here, but you got to think either they need more or they need less. Could be part of the answer. The doctor prescribing those should be the one helping you sort that out. Now, in the worst case scenario where the child's has or is really at risk of harming themselves or really at risk of harming somebody else, we have these other medicines. They're pretty potent, but they can help control the aggression to a certain degree, protect the child, protect siblings, protect the parents, and we certainly had to use these medicines with our kids. And again, these are all short term. I'm planning on, if I'm using like either Midodrine or they need a little risperidone to help kind of control this behavior. In my mind, it's only for the short term because we got them on the protocol and we're going to get the brain to recover. So the blood pressure regulates normally. You don't get this kind of response. Okay. So anyhow, so again, all these aggressive kind of negative behaviors, can't focus, hyperactivity, all that kind of stuff, it's all from this one problem of low blood pressure to the brain. And it's typically from autonomic nervous system dysfunction. There's actually quite a bit in the literature talking about the autonomic dysfunction issues in kids with autism. It's just not spoken of much, and I think a lot of clinicians just don't know, what that research means in behaviors in the children and how they're linked. So anyhow, well, that's all for now. Everybody have a good weekend and take care. Thank you. Bye.